I'm about to reveal something that might shock you. Something that could be killing you right now, even though your doctor says your numbers are perfect. I'm Dr. Claire Whitmore, and after 2 decades as a cardiac surgeon, I've watched perfectly healthy people walk into my operating room with devastating falls, not by disease, but by blood pressure targets they trusted completely. These aren't exotic protocols or experimental treatments. I'm talking about the blood pressure target your doctor gave you, the number they told you to achieve, the target they said would protect your heart and prevent stroke. What I'm about to share goes against everything you've been told about blood pressure in older adults. The pharmaceutical companies don't want you to know this. Most doctors won't tell you because they simply follow guidelines without questioning them. But I've seen it with my own eyes, patient after patient, fall after fall, and I refuse to stay silent any longer. By the end of this video, you'll understand exactly which blood pressure is actually safe for your specific age, why the standard 120/80 target can kill seniors, and most importantly, what you can do starting today to protect yourself. This isn't fear-mongering. This is life-saving truth. Stay with me because what you're about to learn could literally add years to your life. Let's start with a patient I'll never forget. Eleanor was 76 years old when her doctor decided her blood pressure was too high. It was 152/88. Nothing catastrophic, but high enough to need treatment. "You need medication," her doctor said. "This will protect your heart." Eleanor trusted her doctor completely. She'd been seeing him for 15 years. If he said 120/80 was the target, that's what she'd aim for. He started her on lisinopril 10 milligrams daily. Eleanor took it faithfully every morning, never missed a dose. Within 2 weeks, her blood pressure dropped to 138/82. Perfect. The medication was working. Problem solved. Or so she thought. 6 months later, at her follow-up appointment, Eleanor's blood pressure was climbing again. 142/86. Then 148/90. Her doctor looked confused. "Are you taking your medication every day?" "Every single day," Eleanor confirmed. "I never miss." "Your body must be developing resistance," her doctor said. "We'll add hydrochlorothiazide, a water pill. This will help." Second medication added, hydrochlorothiazide 25 milligrams daily. Within 2 weeks, blood pressure dropped to 135/80. Excellent control again. Problem solved. For about 4 months. Then the same pattern started. Slow climb. 138/82. Then 142/86. Then 148/90. Back where she started, despite 2 medications. Her doctor added amlodipine, third medication, 5 milligrams daily. Blood pressure dropped to 132/78. Perfect control. For 3 months. Then climbing again. 138/82. 142/86. The medications weren't working anymore, weren't holding. Something was wrong, but nobody could figure out what. Eleanor felt different almost immediately after reaching perfect blood pressure control. She felt tired all the time. Not normal tiredness, profound, crushing exhaustion. She'd sleep 8 hours, wake up feeling like she hadn't slept at all. Getting out of bed required enormous effort. Making coffee was exhausting. Everything required energy she didn't have. She told her doctor at the 2-week follow-up. "This is normal," the doctor said. "Your body needs to adjust. Give it time." But it never adjusted. The fatigue became Eleanor's permanent state. 3 weeks after reaching perfect blood pressure control, Eleanor started noticing something strange. When she stood up from sitting, she'd feel dizzy. Just for a few seconds. The room would spin. She'd have to hold on to something until it passed. She mentioned it to her doctor. "That's probably just age-related," he said. "Your blood vessels aren't as elastic as they used to be. It takes a moment for blood pressure to adjust when you stand. Stand up slowly. Take your time." Eleanor tried. Stood up slowly, very slowly. The dizziness continued. At 6 weeks, Eleanor mentioned the symptoms again to her doctor. Could this be the blood pressure medications? The doctor was dismissive. "These symptoms can happen at your age. Let me check your pressure." He checked. 122/74. Perfect numbers. "Your blood pressure control is excellent," he told her. "Keep doing what you're doing." But Eleanor didn't feel excellent. She felt terrible. The dizziness was getting worse. Every time she stood. Every time she got out of bed. Every time she got up from the couch. 2 months after reaching perfect blood pressure control, Eleanor was afraid. Terrified, actually. She'd wake up at night needing to use the bathroom. She'd sit on the edge of the bed for a full minute before standing. Afraid the dizziness would make her fall in the dark, she'd installed grab bars in her bathroom, nightlights everywhere, moved cautiously like she was walking on ice. Her daughter started calling every morning. Just checking on you, Mom, making sure Eleanor was okay, making sure she hadn't fallen during the night. I'm fine, Eleanor would say. But she wasn't fine. She was living in fear. Fear of falling. Fear of being alone. Fear that one morning her daughter would call and she wouldn't answer because she'd fallen and couldn't get to the phone. Then, one Tuesday afternoon, Eleanor was in her kitchen. She'd been sitting at the table reading. She stood up. The familiar dizziness hit, stronger than usual. The room spun violently. Her vision went dark around the edges. Eleanor reached for the counter, missed. Her legs gave out. She fell hard, hit her head on the tile floor. The sound echoed through her empty house. When she didn't answer her daughter's evening call, her daughter drove over, found Eleanor on the kitchen floor, unconscious. Blood pooled under her head. She'd been lying there for hours. The ambulance rushed Eleanor to the hospital. Severe head injury, brain bleed. The ER doctor checked her blood pressure immediately. 98/62, dangerously low. That's why she'd fallen. Blood pressure dropped too low when she stood up. Her brain didn't get enough blood. She passed out. Eleanor never woke up. The brain bleed was too severe. She died 3 days later. 76 years old. Died from a fall caused by blood pressure that was too low. Blood pressure her doctor had been maintaining at perfect levels for months. After Eleanor died, her daughter went to see Eleanor's doctor, brought Eleanor's blood pressure log. All those perfect readings, 122/76, 118/74, 125/78. You kept my mother's blood pressure at 120/80, her daughter said, voice shaking with anger and grief. You said it was perfect. You said that's exactly where she should be. But she was dizzy all the time. She was terrified of falling. And she did fall. And she died. The doctor looked uncomfortable. Those are the guideline targets. 120/80 is recommended for good cardiovascular health. Recommended for whom? Eleanor's daughter demanded. For 40-year-olds? My mother was 76. Her blood pressure was too low for her age. It made her dizzy. It made her fall. It killed her. The doctor had no answer. He'd been following guidelines, doing what he was taught, achieving perfect numbers. Those perfect numbers had killed his patient, and he didn't even understand why. Eleanor's story shows you why blood pressure targets can't be the same for everyone. What's perfect for a 40-year-old can kill a 76-year-old. But most doctors don't know this, or they know it but don't act on it. Now comment dizzy when standing if you get dizzy when you stand up from sitting or lying down, even if it's brief, even if you think it's normal aging. It's not normal, and it's dangerous. Eleanor's story reveals the danger. But why do doctors make this mistake? Why do they use 120/80 as the target for everyone, regardless of age? There are 5 reasons. 5 things doctors believe that lead them to use dangerous targets in older adults. Reason number 5 is that doctors are taught lower is better and never unlearn it. In medical school, doctors learn that high blood pressure causes strokes, heart attacks, kidney disease. They learn that lowering blood pressure prevents these complications. This is true, absolutely true. But they learn this in the context of middle-aged adults. The studies, the trials, the research, all done primarily in people aged 40 to 65. Healthy people, active people, people with decades of life ahead. For these people, lower blood pressure is better. Achieving 120/80 or even lower reduces risk, prevents disease, extends life. But doctors generalize. They assume what works in 40 to 65-year-olds works in 80-year-olds. They never question whether the targets should be different. Never consider that an aging body might need different management. Lower is better becomes gospel, unquestioned, applied to everyone. But it's wrong for seniors, and it's killing them. Reason number 4 is that doctors fear being accused of inadequate treatment. Imagine you're a doctor. Your 78-year-old patient has blood pressure of 145/85. Guidelines say target is 120/80. If you don't treat more aggressively, several things could happen. Insurance companies might flag your care as inadequate. Quality metrics might rate you poorly. If the patient has a stroke, even years later, someone might look back and say you didn't control blood pressure adequately. The medical legal environment pushes doctors toward aggressive treatment, toward lower numbers, toward following guidelines strictly, even when clinical judgment suggests otherwise. It's safer for the doctor's career to follow guidelines and achieve perfect numbers, even if those perfect numbers are harming the patient. Even if the patient is dizzy and falling, at least the doctor can say they followed standard of care. They can't be blamed for following guidelines, but they can be blamed for not following them. Reason number 3 is that doctors don't adequately account for how aging changes the cardiovascular system. As you age, your arteries naturally stiffen. This is called arteriosclerosis. It happens to everyone. The elastic fibers in artery walls gradually get replaced with stiffer collagen. This is a normal aging process, not a disease. Normal aging. When arteries are stiff, they can't expand and contract as easily as young, flexible arteries. This means your heart has to generate more pressure to push blood through stiff pipes. It's like the difference between pushing water through a rubber hose versus a metal pipe. The metal pipe requires more pressure to get the same flow. Your brain, sitting at the top of your body, is particularly vulnerable. Blood has to fight gravity to reach your brain. When you're young with flexible arteries, 120 millimeters of pressure at the heart is plenty to get adequate blood flow all the way up to your brain. But when you're 75 with stiff arteries, 120 might not be enough. You might need 135, or 140, or even 145 to maintain adequate brain perfusion. If your doctor artificially lowers your pressure to 120 using medications, your brain might not be getting adequate blood flow, especially when you stand up and gravity becomes an even bigger obstacle. This causes dizziness, confusion, falls. Exactly what happened to Eleanor. But doctors don't think about this physiologic reality. They see 120/80 as the target. They achieve 120/80. They consider it success. They don't consider whether that number is actually appropriate for that specific patient at that specific age. Reason number 2 is that doctors rely on studies that excluded the very patients they're now treating. The SPRINT trial. This is the study everyone cites when they argue for aggressive blood pressure lowering. SPRINT showed that lowering systolic pressure to below 120 reduced cardiovascular events compared to a target below 140. Sounds great. Lower is better. Except look at who was excluded from SPRINT. People with diabetes, people with prior stroke, people in nursing homes, frail elderly, anyone at high risk of falls. The study showed benefit in a carefully selected group of relatively healthy older adults with an average age of 68. But that's not who's being treated in the real world. In the real world, doctors are applying these aggressive targets to everyone, including the frail, the very old, those at high risk of falls, exactly the people who were excluded from SPRINT. And what happened to the people in the intensive treatment group? They had more hypotension, more fainting, more acute kidney injuries, more falls. The study proved aggressive lowering helps some people and harms others, but doctors only remember the first part. Reason number 1 is that doctors ignore the research that actually applies to elderly patients. The HIVET trial. This study specifically looked at people over 80, not 68, not relatively healthy, people over 80, the exact population that gets overtreated most aggressively. HIVET found that treating blood pressure to around 150 systolic reduced strokes and heart failure, without causing the negative effects of aggressive lowering. The key finding? Moderate blood pressure control was beneficial. Aggressive lowering to 120 or below was not required and caused harm. Yet how many doctors follow HIVET? Almost none. They follow SPRINT and apply it to everyone, including the exact people who were excluded from the study. This is why Eleanor died. Because her doctor followed guidelines extrapolated from the wrong population. Before we continue with what blood pressure you should actually target, I want to make a quick request. If what you've heard so far seems valuable, I'm asking for two simple things. First, subscribe to this channel. My mission is to provide clear, straight-shooting health information so you can make the best decisions. Second, and perhaps more important, share this video. Think about your parents, your grandparents, your friends. A simple click can start a conversation that could genuinely save a life. Thank you for your support. Let's continue. Now I'm going to show you something that will change how you think about blood pressure forever. It's called the J-curve, and it proves that lower is not always better. Look at this graph. On the bottom, we have blood pressure from very low to very high. On the side, we have mortality risk. You'd think the line would show that as blood pressure goes down, mortality goes down. A straight line. Lower pressure, lower risk. That's what we've been told. But that's not what the research shows. The research shows a J-shaped curve. As you lower blood pressure from very high levels, mortality risk does go down, but only to a point. Once you get below a certain threshold, mortality risk starts going back up. The curve looks like the letter J. This is called the J-curve phenomenon, and it shows there is a point where lowering blood pressure too much actually increases your risk of death, not decreases it. Why? Because your organs need adequate blood flow. Your brain needs blood flow. Your heart needs blood flow. Your kidneys need blood flow. When you lower pressure too much, these organs don't get adequate perfusion. They start failing. The bottom of the J-curve, the point of lowest mortality risk, is different for different age groups. For someone in their 40s, it might be around 120 systolic. For someone in their 70s, it might be around 140. For someone in their 80s, it might be around 150. But doctors treat everyone the same. They push everyone to 120, regardless of where their individual J-curve bottom actually is. This pushes many seniors past the bottom of the curve and up the other side, where mortality risk increases again. Eleanor was pushed past the bottom of her J-curve. Her doctor was trying to reduce her risk by lowering her pressure, but he actually increased her risk by lowering it too much. Let me show you what success looks like. Margaret was 78 when her doctor wanted to start blood pressure medications. Blood pressure, 148/86. I want to get you to 120/80, her doctor said. Margaret said no. Give me a second opinion first. She went to a geriatric cardiologist, someone who specializes in older adults. The geriatric cardiologist looked at Margaret's pressure. 148/86 at age 78? That's perfectly acceptable. That might even be optimal for you. Margaret was confused. But my regular doctor said it's too high. The cardiologist shook his head. 120/80 is often too low for someone your age. Your arteries have naturally stiffened over 78 years. Your body needs somewhat higher pressure to maintain adequate blood flow to your brain and organs. Lowering you aggressively to 120 could cause dizziness, falls, even cognitive problems. So, I don't need medications? Margaret asked. Not at 148/86, the cardiologist said. If it climbs above 160, we'll talk. But right now, you're in a safe range for your age. Margaret is 84 now, 6 years later. Her blood pressure has stayed in the 145 to 155 range. No medications, no dizziness, no falls. Sharp, active, independent. She avoided Eleanor's fate because one doctor understood. Blood pressure targets must be age-appropriate. Now here's the action step that could save your life. The stand test. This is something every senior on blood pressure medications should do, but almost nobody knows about it. Here's how it works. Step 1. Sit quietly for 5 minutes. Relax. Don't talk, don't move around. Just sit. Step 2. Check your blood pressure while sitting. Use a home blood pressure monitor. Write down the numbers. Let's say it's 128/75. Step 3. Stand up. Immediately after standing, start a timer. Step 4. Check your blood pressure again after standing for 1 minute. Write down the numbers. Let's say it's 110/68. Step 5. Check your blood pressure again after standing for 3 minutes. Write down the numbers. Let's say it's 105/65. Now compare. Sitting, 128/75. Standing 1 minute, 110/68. Standing 3 minutes, 105/65. This person has orthostatic hypotension. Their systolic pressure dropped 23 points. Their diastolic pressure dropped 10 points. This is dangerous. This person is a fall waiting to happen. If this is you, you need to tell your doctor immediately. Your blood pressure medications need to be reduced, not increased, reduced. Your sitting pressure might look perfect, but your standing pressure is dangerously low. You're being overtreated. Now here's what's tragic. Most doctors never check standing blood pressure. They check sitting pressure only. See perfect numbers, think everything is fine. Meanwhile, the patient is dizzy every time they stand, falling, fracturing bones, losing independence, all because nobody checked standing pressure. The stand test should be mandatory for every senior on blood pressure medications, but it's not. So you have to do it yourself, at home, and bring the results to your doctor. This is the data that will save your life. Now I'm revealing what blood pressure is actually safe for different ages. These are based on clinical research, real studies in real older adults, not guidelines extrapolated from younger populations. But before I give you the numbers, understand something critical. These are ranges, not rigid targets. Every person is different. Your specific target depends not just on your age, but also on your overall health, your frailty level, your fall risk, whether you have diabetes or kidney disease or prior stroke. Medicine is not one size fits all. Anyone who tells you there's one perfect number for everyone is lying or ignorant. Ages 60 to 69, the transitional decade. For people in their 60s who are generally healthy and active, a reasonable blood pressure range is 120 to 135 systolic over 70 to 80 diastolic. Notice, this is a range, not a single target. Anywhere in this range is acceptable. If you're 65 and your pressure is 132 over 76, that's fine. You don't need more medications to force it down to 120. If it's 125 over 72, that's also fine. The range gives flexibility. The key things to avoid in this age group: systolic pressure below 120 if you're having any symptoms, dizziness, fatigue, and diastolic pressure below 65. Low diastolic pressure is dangerous, even when systolic looks good. Your heart muscle gets its blood supply during the diastolic phase. If diastolic pressure is too low, your heart doesn't get adequate blood flow. This increases heart attack risk, even though your systolic number looks beautiful. Ages 70 to 79, the critical adjustment. For people in their 70s, the range shifts upward. A reasonable target is 130 to 145 systolic, over 65 to 80 diastolic. This is higher than standard guidelines recommend. But this is what keeps people in their 70s safe and functional. If you're 74 and your pressure is 138 over 74, that's excellent. Don't let anyone tell you it's too high. Don't let anyone add medications to force it lower. If you're 72 and your pressure is 142 over 78, that's also fine. That's protecting your brain and organs, while avoiding excessive medication burden. In this age group, you must watch for warning signs that pressure is too low: dizziness when standing, chronic fatigue that doesn't improve with rest, mental fog or confusion, any falls. If you're experiencing any of these symptoms, and your blood pressure is below 130, your pressure is too low. It needs to come up, not go down further. Age 80 and older, the protective range. For people 80 and older, the safe range is 140 to 150 systolic, over 65 to 85 diastolic. This is significantly higher than what most doctors target, but this is what research in very old adults shows is safe and beneficial. Remember the HIVET trial? They found that treating blood pressure to around 150 systolic reduced strokes and heart failure, without causing the negative effects of aggressive lowering. If you're 82 and your blood pressure is 145 over 75, that's protecting you. That's giving your brain adequate perfusion. That's preventing falls. Don't let anyone convince you it's dangerously high. It's not. It's appropriate for your age. The absolute worst thing that can happen to someone over 80 is aggressive blood pressure lowering. Getting pressure below 130 in this age group dramatically increases fall risk. Falls lead to fractures. Fractures lead to immobility. Immobility leads to pneumonia and blood clots. This cascade kills people. Perfect blood pressure numbers are meaningless if you're dead from a fall. Now comment your age and your current blood pressure right now. Comment if your doctor is trying to get you below 120. Comment if you're experiencing dizziness or falls. I need to see what people are dealing with. Now let me teach you something that could save your life, something most doctors never check. Pulse pressure. This is the difference between your systolic and diastolic numbers. If your blood pressure is 140/70, your pulse pressure is 70. If it's 130/90, your pulse pressure is 40. Normal pulse pressure is 40 to 60. When pulse pressure gets too wide, above 60, it indicates very stiff arteries. When it gets too narrow, below 40, it can indicate heart problems. But here's what's most important for seniors. A wide pulse pressure with low diastolic pressure is extremely dangerous. Let's say your blood pressure is 130/55. Pulse pressure is 75. Very wide. Your systolic looks reasonable at 130, but your diastolic is dangerously low at 55. This means two things. Your arteries are very stiff, and your heart muscle is not getting adequate blood flow. Multiple studies have shown that diastolic pressure below 60 increases heart attack risk, increases stroke risk, even increases dementia risk, because of reduced blood flow to the brain. Yet doctors focus almost exclusively on systolic pressure and ignore diastolic pressure completely. If your diastolic pressure is below 60, your blood pressure medications need to be reduced, period. Even if that means your systolic pressure rises slightly. A blood pressure of 145/70 is much safer than 125/55. The higher diastolic pressure protects your heart and brain, even though the systolic is higher. Advanced additions for keeping blood pressure in the safe range. Magnesium, 400 milligrams daily before bed. Natural calcium channel blocker. Works synergistically with blood pressure medications. Helps maintain proper range without over-medication. Coenzyme Q10, 200 milligrams daily. Supports heart muscle. Protects against oxidative stress. Helps maintain healthy blood pressure naturally. Potassium from food, 3,500 to 4,000 milligrams daily. Beans, avocados, spinach, sweet potatoes. Helps kidneys regulate sodium. Maintains healthy pressure without medication escalation. The complete protocol costs under $50 monthly. Compare that to blood pressure medication costs, plus managing side effects of overtreatment, plus fall injuries, plus destroyed quality of life. Natural support is cheaper, more effective, infinitely better. Join our community, link below. Thousands following age-appropriate blood pressure management. Stephen avoided overtreatment at 78. Susan reduced medications after learning her standing pressure was too low. Robert's dizziness lifted when pressure target was adjusted for his age. Real people, real success. Next week's video reveals the 3 minerals that naturally support healthy blood pressure. Combined with age-appropriate targets, they create comprehensive cardiovascular protection. Subscribe now. Share this with everyone on blood pressure medications. Everyone suffering like Eleanor. You can save someone from overtreatment destruction by sharing. Your blood pressure target might be protecting you at the wrong level, but you have a choice now. Age-appropriate targets, stand test monitoring, natural support, same protection, no falls. Start today. Do the stand test tonight. Know your safe range. Talk to your doctor tomorrow. Choose appropriate targets over dangerous guidelines. Thank you for watching. Start the stand test tomorrow. Join the community. Subscribe for next week's mineral support video. And avoid the overtreatment that age-inappropriate targets cause.